Have you ever noticed a persistent sore throat, hoarseness, or even an unusual lump in your neck that just won't go away? Most of us shrug off these symptoms, thinking it's just a cold or stress. But what if I told you these could be early warning signs of something far more serious, throat cancer? Throat cancer often develops silently, and by the time symptoms become obvious, it may already be in an advanced stage. While it's more common in men over 50, anyone can be at risk. The good news? Early detection can significantly improve survival rates, but only if you know what to look for. In this video, we'll uncover the 10 warning signs of throat cancer that no one talks about. If you experience any of these, don't ignore them, consult your doctor immediately. Number 1, voice changes and hoarseness. Have you ever had a hoarse voice after cheering at a game or talking too much? That's normal. But what if your voice stays hoarse for weeks, even when you're not sick? Persistent hoarseness or voice changes lasting more than 3 weeks could be an early warning sign of throat cancer. Your larynx, voice box, is responsible for producing sound, and if a tumor develops, it can affect how your vocal cords work. This could make your voice sound raspy, weak, or strained, and you may find yourself clearing your throat frequently. While cancer is a possibility, other less serious conditions can also cause voice changes. Laryngitis, for example, happens when your vocal cords become inflamed from a cold, allergies, or overuse. Neurological disorders like Parkinson's or stroke can also interfere with vocal cord control. Another common cause is GERD, acid reflux, where stomach acid irritates the throat, leading to chronic hoarseness. If your hoarseness lasts longer than 3 weeks without improving, or if it comes with difficulty swallowing, persistent coughing, or unexplained weight loss, it's time to see a doctor. Early detection is key, don't ignore your body's signals. If caught early, throat cancer can be treated effectively. So, if your voice just doesn't sound like it used to and it's not getting better, don't wait, get it checked out. Number 2, persistent bad breath, halitosis. Bad breath is something we all experience from time to time, especially after eating certain foods or waking up in the morning. But what if your bad breath doesn't go away, no matter how much you brush, floss, or use mouthwash? Persistent bad breath lasting more than 3 weeks could be a sign of something more serious, possibly throat cancer. Cancerous tissues in the throat, tonsils, or mouth can create an environment where bacteria thrive, leading to a strong, unpleasant odor. This type of halitosis, chronic bad breath, won't improve with typical oral hygiene because the source isn't in the mouth, it's deeper in the throat. Other causes include poor oral hygiene, gum disease, and dry mouth, xerostomia, which reduces saliva production and allows bacteria to build up. Digestive disorders, like acid reflux, can also contribute to chronic bad breath by allowing stomach acids to reach the throat. Diabetes can cause a fruity or acetone-like smell, while kidney or liver disease can lead to breath that smells like ammonia. So, when should you be concerned? If your bad breath lasts longer than 3 weeks and is accompanied by throat pain, swelling, difficulty swallowing, or lumps in the neck, it's time to see a doctor. Don't ignore persistent bad breath, it might be more than just a nuisance. Early detection could make all the difference. Number 3, persistent earache, radiating to the throat. Ear pain is something we often associate with infections, allergies, or even pressure changes when flying. But what if your earache lasts longer than 3 weeks, and there's no infection? A persistent earache, especially one that radiates to the throat, could be an early warning sign of throat cancer. The ears and throat are closely connected by nerves, so a tumor in the throat or tonsils can put pressure on these nerves, causing referred pain in one or both ears. This means that while your ear might hurt, the real problem could be in your throat. Unlike common ear infections, this type of pain doesn't come with fever, ear drainage, or temporary hearing loss. Of course, not all earaches mean cancer. Other possible causes include ear infections, otitis media, where fluid builds up in the middle ear, causing pain and discomfort. Temporomandibular joint, TMJ, disorders, which affect the jaw joint, can also lead to chronic ear pain. Eustachian tube dysfunction, when the small tubes that help drain fluid from the ear get blocked, can also cause persistent ear discomfort. So, when should you be concerned? If your ear pain lasts longer than 3 weeks, does not improve with treatment, and is accompanied by difficulty swallowing, voice changes, or a lump in the neck, it's time to see a doctor. Your body might be signaling a deeper issue, and catching it early can be life-saving. Number 4, lump in the neck. Feeling a lump in your neck can be alarming, but before you panic, know that not all lumps are cancerous. Sometimes, swollen lymph nodes are just your body's way of fighting off an infection. But if you notice a painless or painful lump that keeps growing and doesn't go away after 2 to 3 weeks, it could be a sign of something more serious, possibly throat cancer. Lymph nodes are part of your immune system and often swell in response to infections like the common cold, mononucleosis, tuberculosis, or even HIV/AIDS. In these cases, the swelling usually goes down after your body clears the infection. Autoimmune diseases like lupus or rheumatoid arthritis can also cause persistent lymph node swelling. However, if the lump keeps growing, is firm and doesn't move, or is accompanied by unexplained weight loss, night sweats, or difficulty swallowing, it's time to see a doctor. Cancerous lymph nodes are usually larger than 1 centimeter, about 0.4 inches, in diameter and don't shrink like normal swollen nodes do. Remember, early detection is key. If your lump doesn't go away after a few weeks or keeps getting bigger, don't wait, get it checked. It might be nothing, but if it's something serious, catching it early can save your life. Number 5, persistent sore throat. A sore throat is something we've all dealt with, usually from a cold, allergies, or even talking too much. But what if your sore throat lasts for more than 3 weeks and doesn't come with flu-like symptoms? That's when it's time to take a closer look, as chronic irritation in the throat could be an early sign of throat cancer. Throat cancer can cause ongoing inflammation and discomfort, making it feel like you constantly have something stuck in your throat. Unlike a typical sore throat that improves in a few days, this kind lingers and may gradually worsen. Of course, there are other possible causes. GERD, acid reflux, is a common culprit, where stomach acid flows back into the throat, causing irritation. Postnasal drip from allergies can also lead to throat discomfort. Smoking and excessive alcohol use can damage throat tissues over time, leading to persistent inflammation. If your sore throat lasts longer than 3 weeks, especially if it's accompanied by difficulty swallowing, hoarseness, unexplained weight loss, or a lump in the neck, don't ignore it. These could be signs of something more serious. If a sore throat sticks around longer than usual and doesn't seem to have an obvious cause, get it checked by a doctor. Early diagnosis could make all the difference. Number 6, difficulty swallowing, dysphagia. We all struggle with swallowing sometimes, maybe after eating too fast or when we're sick. But if you start feeling like food is getting stuck in your throat regularly, or swallowing becomes difficult without an obvious reason, it could be a sign of something more serious. Persistent difficulty swallowing, dysphagia, is one of the key warning signs of throat cancer. A growing tumor in the throat or esophagus can partially block the passage of food and liquids, making it harder to swallow. At first, you might just notice mild discomfort when eating solid foods, but as the condition worsens, even swallowing liquids or saliva can become challenging. Not all swallowing difficulties mean cancer. Other potential causes include GERD, acid reflux, which can cause irritation and narrowing of the esophagus over time. Esophageal strictures, or scarring from long-term acid exposure, can also make swallowing harder. In some cases, neurological conditions like stroke or Parkinson's disease may affect the muscles used in swallowing. If difficulty swallowing comes on suddenly, gets progressively worse, or is accompanied by weight loss, throat pain, or a persistent cough, it's time to see a doctor. Early detection can make a huge difference in treatment options and outcomes. Don't ignore persistent trouble swallowing, your body is trying to tell you something. Number 7, persistent cough. We all get coughs from time to time, whether from a cold, allergies, or just a dry throat. But if your cough lasts longer than 3 weeks and doesn't seem to be getting better, it's time to take it seriously. A persistent cough, whether dry or with phlegm, can be an early warning sign of throat cancer. When a tumor develops in the throat, it can irritate the tissues, triggering a chronic cough that won't go away. This is especially concerning if your cough is accompanied by hoarseness, difficulty breathing, or even blood in your sputum. That said, not all long-term coughs are cancer-related. Common causes include asthma, bronchitis, postnasal drip, and seasonal allergies. Gastroesophageal reflux disease, GERD, can also cause a lingering cough by irritating the throat with stomach acid. So, when should you worry? If your cough lasts longer than 3 weeks and comes with other symptoms like voice changes, shortness of breath, or unexplained weight loss, it's time to see a doctor. If you cough up blood, don't wait, seek medical attention immediately. A cough might seem harmless, but if it sticks around and doesn't respond to usual treatments, your body could be signaling a deeper problem. Early detection can make all the difference, so don't ignore a persistent cough, get it checked out. Number 8, unexplained weight loss. Losing weight is often seen as a good thing, especially if you're trying to shed a few extra pounds. But what if you start losing weight without trying, and it keeps happening? If you've lost more than 10 kilograms, 22 pounds, in 6 months without changing your diet or exercise habits, it could be a serious warning sign, including throat cancer. Cancer cells grow and multiply rapidly, using up the body's energy and causing unintentional weight loss. In throat cancer, tumors can also make swallowing difficult, leading to reduced food intake and malnutrition. This weight loss is often accompanied by other symptoms like fatigue, persistent sore throat, or difficulty swallowing. Not all unexplained weight loss means cancer. Conditions like hyperthyroidism, an overactive thyroid, can speed up metabolism, causing rapid weight loss. Diabetes can lead to weight loss due to changes in how the body processes sugar. Depression and stress can also affect appetite and eating habits, leading to unintended weight loss. If you're losing weight quickly without any explanation, and it's paired with persistent cough, hoarseness, or trouble swallowing, it's time to see a doctor. Your body could be trying to tell you something serious. Early detection is key, don't ignore unexplained weight loss. Number 9, difficulty breathing. We all experience shortness of breath occasionally, maybe after climbing a flight of stairs or during intense exercise. But if you find yourself struggling to breathe even at rest, it could be a sign of something far more serious. Difficulty breathing, also known as dyspnea, can occur when a tumor in the throat or airway starts blocking airflow, making it harder for air to pass through. This kind of breathing difficulty doesn't come and go like a typical cold or allergies, it often worsens over time. If throat cancer is the cause, you might also notice other symptoms like hoarseness, persistent coughing, or difficulty swallowing. That said, not all shortness of breath means cancer. Common causes include asthma, pneumonia, bronchitis, or even anxiety disorders, which can trigger episodes of breathlessness. However, unlike these conditions, cancer-related breathing difficulties don't improve with medication or rest. If your shortness of breath gets progressively worse, especially if it's accompanied by chest pain, wheezing, or coughing up blood, don't wait, see a doctor immediately. Your breathing is essential, don't ignore warning signs that could indicate a serious health issue. Number 10. Bleeding in the throat or mouth. Spitting up a little blood can be alarming, but it's not always a cause for panic. Sometimes, minor gum disease, mouth ulcers, or infections can lead to small amounts of bleeding. However, if you notice blood when coughing, spitting, or clearing your throat, and it keeps happening, it could be a sign of something more serious, including throat cancer. In advanced stages of throat cancer, tumors can damage nearby tissues and blood vessels, leading to unexplained bleeding. This might appear as red streaks in saliva, coughing up blood, or a metallic taste in the mouth. If the bleeding is coming from deeper in the throat, you may not even notice it right away, but persistent throat irritation, a lump in the neck, or difficulty swallowing could be accompanying symptoms. That said, not all bleeding in the throat means cancer. Common non-cancerous causes include gum disease, gingivitis, oral infections, or acid reflux, which can irritate the throat lining. But the key difference is that these conditions tend to improve with treatment, while cancer-related bleeding persists or worsens over time. If you have unexplained throat or mouth bleeding that lasts more than a few days and isn't related to oral health issues, or if it's paired with a chronic sore throat, voice changes, or difficulty swallowing, don't ignore it, see a doctor as soon as possible. Early detection could save your life. Throat cancer can develop silently, often showing subtle symptoms that people mistake for minor issues. But if any of these symptoms, hoarseness, persistent cough, difficulty swallowing, unexplained weight loss, or a lump in the neck, lasts longer than 3 weeks, don't ignore it. Early detection is crucial, and catching throat cancer in its early stages can make a significant difference in treatment success. If you or someone you know is experiencing these symptoms, consult a doctor immediately. It's always better to be safe than sorry when it comes to your health. Help spread awareness by sharing this information with family and friends. Knowledge can save lives, and by recognizing these signs early, we can take action before it's too late. Stay informed, stay healthy,